Good afternoon, everybody. I'm sorry, I didn't know that it is the invitation expired. So, how was your exam? Whether you were able to upload? Whether you had any problem? Yes, no one is there to answer. Are you able to hear me? Okay, so you did not have any issues with today's subject, pharmacology. Did you take pharmacology this time? Okay, so you did not have any issues, right? So extra 10 minutes for uploading will be enough, I guess. Okay, so we will move to our subject. Um, so many people had one single doubt. Maybe in different ways, many were asking about the exercises in hydrotherapy. So first thing I want to emphasize is you need to like there is whenever you are giving hydrotherapy, you will have two set of people, one set of people who are having neurological problem and who is having a lesser muscle power, who will not be able to stand by themselves, who needs support. Those kind of people will be there. For them also you will be giving hydrotherapy. This is one category. Okay, so the other category will be maybe hydrotherapy for a sports person. If you want to increase further fitness, hydrotherapy for any other person who are normal but still need has any pain or any other issue in the joint, so that's why they are not able to do the movement. So for those people also you will be giving hydrotherapy. Is that clear? So first thing is uh, whenever the person is not able to stand or maintain the position by themselves, that is if you are making them to sit on the noodles, if the person is able to sit on the noodles by themselves, able to manage their position by themselves, then you can further consider the water properties to help them to do the movement. Okay, for people who are having a neurological problem where you find it difficult to position them and maintain them, you can still do the manual movements, like how you will be doing the manual exercises in land, same like that you will be able to do it. Okay, so this water position, it is not only the buoyancy and other things. So you have hydrostatic pressure, you have the thermal properties. So you can do the same manual exercises inside water and use this other than buoyancy, you can use the other properties also to improve the particular person. Is that clear? So all the exercises, whatever you are doing in land, you can do it in water. Only thing is, instead of dumbbell, you will be using a floater or the material of the dumbbell will be different. Other than that, everything you can do as per land. Okay, so this is one category of exercise. Plus, you can use the buoyancy as a assistive device or resistive device to help you to do the movement. Is that clear? Okay, so in the book, in Caroline Kistner book, whatever they have given under the strengthening, stretching topics, like there they have given the same manual exercises that are done inside the water. Okay, plus you can use the buoyancy to help them. Is that clear? Are you clear? Okay. Okay. So, like we had some questions last time, and we did not discuss last week because we did not have time. So, can we start with that discussion? So, we started with shoulder flexion and extension, isn't it? So, we started with shoulder flexion and extension. So any doubt in shoulder flexion and extension. So you can use the same shoulder like land exercises inside water. No doubt in that. Apart from that, you can also use the buoyancy as your thing. So when you are using the buoyancy, then you need to think of positioning the person according to the buoyancy. Okay, so you cannot just position them as normal person. Okay, so okay, so just for little more clarification, I'll show you two types of videos. In one video, they would have used the, so one video is for a patient who has a neurological problem. Another video is for a person, for a normal person, how they are doing. Okay, so let me just show you two types of videos. My name's Veronica. I'm a So the first video is related to shoulder. You can just see this is they have done this hydrotherapy exercises for a person who had a shoulder injury and they have undergone a surgery. Okay, so you can see here the person has a lateral repair of shoulder. That means they have done a surgery to do a rotator cuff repair. Is that clear? So for those like for these patients, lateral repair of the shoulder, rotator cuff, and acute AC joint strain. So this is your acromioclavicular joint strain. So for these people, how they are giving exercises after surgery. Is that clear? This is after surgery. My name's Veronica. I'm a co-owner of Hydrotherapy. My primary scope of practice is in the This is Shelly. She injured her right shoulder. A year ago, like that. It's something like it had a leg repair in October.
really seemed to help her be much less guarded and work through her range of motion and make some nice gains. Her injury was a year ago and her surgery wasn't until October. And then her first aquatic visit, the following week, December 5th. So ideally, would have been great to get her in. Her program, we started just with no extra resistance, with some general range of motion at 90 degrees. But I'll show you mostly with the added resistance because that's where she's at for now. So it's the same exercises, just without the little added tools. If I look back to my notes, her very first visit, when she said that her subjective comment was, "It's so much easier in the water." So I mean, the water has been key. And typically our practice, any patient that we see now with a shoulder injury is in the pool as quick as possible because it just prevents all of the compensatory strategies that people learn to get by with, to function. So in the pool, they tend to not compensate because that buoyancy of the water just facilitates and aids with that range of motion. Easy. Range of motion has improved significantly. Pain levels are better. She can tolerate land exercise now. She started to shoot the basketball. You had swung your golf club. She swung her golf club.
Okay, so did you get a brief idea about the thing? So here the patient is a normal patient who has undergone a mild surgery in the shoulder, and because of that they are using this hydrotherapy to improve her shoulder. So the person will be able to maintain her position by herself inside water alone. She doesn't need any other person's help inside the water. Okay.
One other thing that we had done in the beginning too was just some noodle push downs in the front and at the side. You want to just show a couple of those? And those are really very easy for her at this point, but it's just a good beginning exercise too. We also have
Okay.
a couple sessions we did.
So here if you see, you can use this exercise as a trapezius strengthening exercise also. Okay, so trapezius strengthening also you can use it. Along with that, for shoulder flexor strengthening also you can use this. Okay.
Do a little bit of walking on the treadmill the first 1 or 2 times just to work on some arm swing, but she quickly advanced past that. So just getting the gait back, getting the swing, not compensating. For a lot of people, not so much in her case, but people tend to really guard that arm and hold it up close to their body. So it works well just to work on some swing. So in the beginning, many times that noodle offers a lot of resistance to people, especially when you're using it just on the involved arm for up and down. Oh, I know what else too, Shelly, behind you with 2 hands behind. It's a little internal rotation stretch again too. It's the beauty of the pool. You get a good workout.
So can you see, like they have done for shoulder flexors, extensors, then now internal rotation and external rotation. Okay. So when you are doing internal rotation strengthening, you will be able to stretch the external rotators. Is that clear?
To all the other muscle groups too, not just that shoulder. Legs have to stabilize you, and the stomach muscles. So those are just aqua fins. So just start with. This is more strengthening, and just having her focus too on her scapular movement and trying to make sure both sides are equal has been a big key.
So the first exercises was horizontal abduction adduction. It is counterbalancing gravity. Okay, so this is counterbalancing buoyancy. This is against buoyancy. Shoulder flexion and extension.
When we first started, she definitely did more substitution, a lot of shoulder elevation. So she's improved quite a bit from the first visit. I'll keep that elbow at your side. This one's tough. This is just trying to work on external rotation, and as you can see, she tends to let that elbow come away from her side. Eventually, you can switch to those diagonals to really come down to that. Try to really actually come down to your opposite hip. And then these were the ones where we added your head. Turn with your arm, just to get some cervical range of motion too, because so many times the upper trap and levator gets tight. As I really turn the head this way too. When you're down, turn your head all the way. There you go. Good, and then try the opposite too. So when your arm's out here, there you go. Just getting opposite neck motion, stretching those muscles. All right. Well, I know we did the eights too, figure eights. Good. All right. So why don't you take those off? Do that little stretch this way. So just to stretch into internal rotation, adding that hydrofit cup just adds that little bit of buoyancy.
Okay. So this is the stretching for internal rotation. So if you keep the hand behind, and when you are further, you can also make the person to squat. When you're making the person squat, the hand will be pushed upwards because of buoyancy. And if you're wearing a floater in the hand will be further pushed up because of buoyancy, and that will give you a good internal rotator stretching.
So just try to stretch it back there, Shelly, and hold it. To be so careful for compensation. I mean, people tend to really like.
So can you watch this question? So they have kept the hand here, and when they are squatting down, automatically the hand will be pushed up because of buoyancy and the floater. Okay, so you will get a good internal rotation stretch.
Flex their wrist or. Now, when we first started, I think she could barely get to your butt. Yeah, so that's really some nice progress. Grab a doodle, and we'll have you just first do like the snow angels. Over your head. So just some supine floating to work on. She's gonna lock her feet in the side so she stays still. That helps. So just to work on some ab and adduction. And again, just focus on. Sometimes too, I'll get in the pool with somebody and just feel their scapula to give them that feedback of how those are moving. So just working on the symmetry of that. I would say if somebody has a shoulder injury and gets in the pool, if they don't want to get their hair wet, they aren't going to reap the full benefit of the pool. And same thing with if they're willing to learn to use the snorkel and mask, it makes a tremendous difference in their progress. Because as you can see, if you work just in standing, you pretty much can get to 90 degrees, and that's it. The other one were those clocks. So if you start down here, just get those shoulder blades. So you're just kind of pushing down. Just working on, again, just some scapular strengthening. So it's just a.
So can you see here? This is for scapular strengthening. That is your scapular retractors. Okay, so she is just pushing the shoulder behind, both the shoulders behind, so that the scapular muscles are strengthened. So when she's pushing, she's pushing against the buoyancy. So buoyancy also is giving her the resistance. At the same time, pectoralis major and minor will be stretched. Okay.
I call it a supine clock exercise. If you start with your arms down at like a 6 o'clock hour and just work on pushing down into the water, it gets the scapular muscles engaged again, and then work your way up to the 5 and 7 o'clock and do the same thing. And it gets progressively harder as you work up to 3 and 9 and then way up to overhead. Repetition, people tend to fatigue with this a little more quickly. The other thing, let's see if I can get these. So the bells just add a little extra level of resistance too. So Shelly, with these, just keep those palms up. And it's just that same, actually think of pushing the bells right down to the bottom of the pool. Not literally, but that's the motion. So that just adds that extra bit of resistance.
So Here, the buoyancy is also acting as a resistance, as well as the dumbbell is also an additional resistance. Okay, because when she's pushing the hand down, this dumbbell will try to pull up. The dumbbell will try to float. It will not go inside the water. Okay, so this is giving you additional resistance.
And again, with that, you can start at that 6 o'clock with your hands down and just progressively work on going up. And it definitely is much harder the higher up you go. And it just gets those middle traps, lower traps, rhomboids. So you can see definitely with the right arm, it doesn't go quite as well as the left. All right, let me do that mask and snorkel. So actually, before I would show anybody the mask and snorkel too, usually we go over, I would start them first with the mask and snorkel on and just doing a little bit of squatting to get used to the breathing if they haven't done that before. Also work with them on how to get back up once they're in this lying down position, because sometimes people get in that panic mode. Many times I'd be in the pool with them the first time that they did this. So what she's starting with now is just a little bit of stretching. Just slow that up a little. Yeah, there you go. So just kind of pulling in for a little rest and then stretching out, hanging on to the side of the pool. Shell, you can hold it a little more. Yeah, stretch right up there and hold it. And again, with this, the snorkel and mask just puts the neck in such a much better position and alignment. If she were lying like that, her neck would be really almost hyperextended. She can say that's a great stretch. She was not able to tolerate any of this on land. Was just almost impossible. Just from a pain standpoint, she got in the pool and was really able to move. All right, and then what we also did, we kind of held down this way, and then you can also stretch with the hand and a little more external rotation to get a little combination of external rotation and flexion stretch in that same position. So yeah, if you want to turn around and just hook your feet in there. And then range of motion wise, the snorkel mask is another great way to work over 90 degrees. So just working on, start with that flexion. Yep. So coming up and then a snow angel type of movement.
So this is exactly shoulder extension resistance using buoyancy. Okay, so you lie down in prone lying and try to bring the hand from 180 degrees to neutral. Okay, so this is flexion of shoulder, this is extension of shoulder. Okay, so this is abduction and adduction, counterbalancing gravity, counterbalancing buoyancy.
Just change that stretch of the shoulder again. So here's just getting a little more external rotation. Also, again, just working a little more middle trap. As you can see, it's a little harder for them to get up to 90 degrees because of the lack of external rotation.
So this is stretching and strengthening
you can do a nice
internal
stretch here
rotation
too, again,
and
with that
external
extra
rotation.
cuff for external rotation. So just getting into that position and holding the cuff, just letting the buoyancy pull. Yes. Again, in this position, lots of times people need cueing to just make sure to stay looking down at the bottom of the pool. If you start looking up, again, your neck just goes into that extension position. But to me, this is the way the majority of the patients that I treat with shoulder problems have made the best progress. You know, as I do with the barbell, those push downs with that barbell. So just do the straight push downs, like right at chest level, and then you can also do the stretch where you bring it up overhead and pull down. And this you might start with just a noodle, a little less resistance. And many times people will really feel the difference in their involved side doesn't have as much control. So it just really works
Okay, so this is stretching for your trapezius and strengthening for your uh, stretching for your triceps and strengthening.
Some people can just focus on true shoulder movement versus moving all over the pool.
So same movement they were doing before without any floaters. Now she's doing with the floater. So with the floater, the resistance will be much more higher.
Extra resistance, but you can progress to using the gloves, the aqua fins. You can use the hydrotherapy bells or the barbells, all for extra resistance. Let's just show that rotation stretch too, Shelly, with the mask and snorkel. So just this again and laying down kind of in this position. Not so much back, but more if you're here. Remember, just coming out into this position so you get that stretch into the rotation. And then you can come up into the internal rotation too. And just try to bend that elbow a little bit more. There you go. So that's that external rotation stretch. And then in the beginning, you may have to get in to just help stabilize that shoulder a little bit, just because of the way, like, especially for her.
Okay, so here if you see, both the hands, they have done external rotation stretching. So this is only with the buoyancy. So buoyancy has pushed up the hand and buoyancy is helping the maintain the stretch here. Here, along with the buoyancy, she has also used a floater.
Her injury was over a year ago, so all that learned compensatory strategies, like she's really unlearned a lot of those by being in the pool. I think that's the piece that I find the most is that people get in and they can really not compensate as much because of they're usually such much less pain. And then she tries to get into the internal rotation.
This is internal rotation.
Again, that's such improvement for her. Make sure that hand stays, yes, because what people will do is just that. They'll cheat with their wrist because they feel like they're getting more motion. And someone like her, I believe it was this side that she had some carpal tunnel surgery on, so you want to be especially careful. Started using that jets for a little more resistance to just push-pull work.
Okay, so here if you see, this one, you have one more property that is increasing the movement of water. That will again give you more resistance. So that's what they are doing with this. Okay, so it is kind of a whirlpool where you increase the water velocity. Okay. So she has to, here the resistance will be by the speed of the water, by buoyancy and the floater. So three types of resistance she has to overcome and do the movement. So this is how you increase the resistance as the patient progress. So we cannot just give this in one day. It will take some time. So slowly as they want to increase from maybe from muscle power 3 to muscle power 5, then when you can use this increasing in the velocity, all those things when they have muscle power 4 plus. Can you differentiate the effort she is putting as the water speed has increased? If you see in this, like now in this part, you can know the effort, the extra effort she is putting to do this particular movement.
attention with just that push down and pull up too now. And then just show if that's easier. The faster you go, the more resistance you get on the push down and pull up. Remember that rotation one? So you just hold the board here.
So can you just compare the first part of this video, that same exercise she did using a noodle, that was very, very easy, but same thing she's using this kind of a flat floater, it is becoming tougher. So that means the equipment we are using also will be able to increase or decrease your resistance and assistance.
Rotate and then just extend that back arm out. Rotate and just rotate all the way around. There you go, and then switch. You can also use a kickboard for these exercises too.
Why the resistance of this kind of floater is high means because of the surface area. So the floating surface area is big, so your resistance and assistance will be more compared to noodles.
You can try those rotation ones too, Shelly, with the elbow locked right at your side. Yeah, so they're going to try to keep that elbow right in. There you go.
So this is here, they are using the same kind of land exercises inside water. Okay, so they are using a Tharaband.
Through there and hold the two hands. I think you did two-handed pullbacks. Well, here the pullbacks is just more scapular. Well, and you could, when you do the dumbbells, like the push pull, you're still on the pull back. You definitely get that whole scapular motion strengthening. And we do have her. So shall I go ahead and turn around, and we did pull forwards too. It's really too getting those muscle groups working in all different directions. Just a little more protraction, retraction motion again. So just really keep that elbow straight on those, Shelly. So it's just all the movements really coming from that shoulder and shoulder blade. So now then pull back. There you go. The tendency is to want, because it gets so tight, the tendency is to want to bend that elbow again for making you feel like you're moving more. This exercise is usually really hard for people. The next piece is to turn palm up so you get more external rotation. Because you really have to use your shoulder to do that correctly. And then Sean, the other one was just thumb down, a little more internal rotation. That wrist. I think that she just, from the surgeon standpoint, developed scar tissue much more quickly than an average person, and that's what happens. I think he even said he wished he would have put her in therapy that much sooner. They had given her stuff to do at home, which she did, but told her not to progress, to the next set of exercises until a certain point, and that was not quick enough for her. Her flexion, I think, was around 120. And I think the last we measured, she's about 160. Abduction was about the same. And that's improved. She's probably at 145 or so of abduction now. Her biggest limitations were rotations. Her external and internal rotation were like 30. And now we've gotten her to 60 or 70 with a fair amount of stretching.
Okay, so we are not going to the clinical parts. We just want to know what is the exercises. Okay.
Yes. We just
Okay. So almost same kind of exercises. So you can watch later. Uh, for three different problems, they have used a patient and they have made this video. Okay. Okay. So any doubts so far? Can we have the discussion now? So I'll give you just 5 minutes. Quickly, you decide who will be presenting. Then one of you can present. Then we can have the discussion. Meanwhile, I'll just search for one answer. I just want to show you how you want to write an exam. Okay, so just take 5 minutes break. I will search for that particular notes and I'll come back. Break means like you have to decide who will be presenting. Okay, I hope you remember who were in the break room. We had 6 break rooms and 6 questions. Okay. Have you decided who will be presenting? Why nobody is talking today? Okay, so before going for the discussion, we'll just discuss using this case scenario. Okay, so this is just a sample question. So Mr. Sam, 32-year-old man, presented 1 month after anterior cruciate ligament autograft reconstruction. So today's video, we saw one video, right? Same kind of a surgery. His complaints are knee swelling, decreased range of motion in hip and knee joints. Physiotherapy assessment reveals there is muscle tightness. There is muscle tightness of hamstring, weakness of quadriceps and rectus femoris. So hamstring muscle tightness means posterior aspect of the lower limb. Weakness of quadriceps means quadriceps will be helping you to do knee extension. Rectus femoris is knee hip flexion. Okay, so here they have not mentioned, they have just mentioned the muscles. With the muscles, you are supposed to know what are the movements affected. Okay, so generally they have given hip and knee joint, but specifically here they have given the muscle. So because of hamstring tightness, that is extension will be flexion will be affected because of hamstring tightness. When the hamstring muscle is tight, then hip flexion will be affected and knee extension also will be affected. Okay, so because of weakness of quadriceps, knee extension will be affected. Because of weakness of rectus femoris, hip flexion will be affected. So here you have to use the water property and you have to treat. So you can see the question, define the property of water that would help you to reduce the knee swelling. So which property will help you to reduce the knee swelling? Okay, you can just unmute and you can talk. Okay, so hydrostatic pressure will be helping you to reduce the swelling. So if you just make the person to stand in the water until the hip level, automatically the knee swelling will be reducing. Is that clear? So here, after that, describe few aquatic exercise for him along with progression. So here if you see, first question is which property will be helping you to reduce the knee swelling. Second is using the other property, how you will give exercises, and along with that they have asked for progression also. So for the second question, you can see the explanation here. Yes, any doubt? Anyone has any doubt? Okay. So the second question you can see, how do you give stretching for hamstring muscle? So inside water, if you stand at the way, you have to write where you will be wearing the buoyancy belt. Is that clear? So that means the level of buoyancy you have to write. So the person is standing at the waist level water. That means the buoyancy belt is at the waist level. Then ask the person to do hip flexion. So when the person is doing hip flexion, automatically the buoyancy will be pushing up the leg. So the buoyancy will be giving you the stretch. Is that clear? And you can also do that as a progression using a floater. when you're doing that using a floater, automatically the floater also will help the leg to float in the water. That will be giving a very good stretch for your hamstring. Is that clear? So this is your first part. Second part regarding the strengthening. Second part regarding the strengthening, hip flexors strengthening, that is your rectus femoris muscle. So how do you strengthen? First is buoyancy eliminated position. So here you will be lying down and side lying and do the hip flexion. So in side lying, if you do hip flexion, you can lie down. If you want to exercise in the water, you can lie down in the if you want to exercise for the right side, you can lie down in the right side and you can do the exercise. So this will help you to do buoyancy eliminated hip flexion. Then if you want to do with assistance of buoyancy, then make the person stand in water, then do the movement. So that will be giving you buoyancy assisted. Then if you want to do a resisted, then you have to make the person to be in prone lying. So in prone lying, from neutral, make the person to do the flexion, hip flexion. So this will give you buoyancy resisted. So how you want to increase the progression of these three, you can use any kind of floaters. So if you use a smaller floater, the resistance will be mild. If you use a bigger floater, flat one, then the resistance will be higher. So this is one kind of progression. You can also increase the speed of water and you can give the resistance. Is that clear? So that is another way. So you can add that. Okay, then next is, it should be knee flexion. Next muscle is quadriceps. So quadriceps muscle, how do you strengthen the quadriceps muscle? So first is, you can put in eliminated position, you have to do in side lying position. Okay, so in assistance, you can go for prone lying. In prone lying, if you do knee flexion, then it is assistance buoyancy. Okay, so you can do well in prone lying. Then resistance will be making the person to be in standing. In standing, you can make the person to do knee extension. Okay, so that will be giving you resistance. Okay, so you can also do resistance quadriceps by doing squatting. Okay, so if you do squatting, that also will be giving you resistance. Okay, then progression can be made by using the floaters and using the speed of the water level. Is that clear? So this is how I just want you to do the presentation. Sorry, like if they have given the muscle power, then you can go with the exact muscle power. So that means if they have given muscle power 2, then according to that you can do. If they give muscle power 4, then according to that you can start writing. If they have not given, then you have to write all three. Is that clear? So if they have not given anything, then you have to write all three. Okay, so next question. So same thing, same kind of question for the shoulder. Okay, so here so rotator cuff surgery has been done, and the person is going to go back and he has shoulder adductor tightness. Okay, shoulder adductor tightness, shoulder extensors and elbow extensors are weak, which is leading to reduced range of motion in the shoulder and the elbow joint. So first question is define buoyancy and its clinical uses. So you can just define using your own words. Then second question, describe aquatic exercise for him to improve his shoulder uh, and elbow range of motion in buoyancy, assisted, resisted and eliminating position along with progression. So here you have to increase the stretching, write about the stretching also. Is that clear? So shoulder adductors are tight. So for that, self-stretching is do shoulder abduction in standing in cervical level water. So when you do shoulder abduction in cervical level of water, automatically shoulder adductor will be stretched, and buoyancy will helping you to do the movement adduction, okay, and maintain it. So if you want to progress, you can use it with floater. The next is strengthening. So strengthening for eliminated, assisted and resisted. Is that clear? So see, don't think that same kind of questions will come. So this is very old question paper I have taken, and I want to explain you how you want to do. So that's why I have just taken, it's a old question paper. Don't think the same question, don't expect the same question in the midsum. Okay, something related to like this also can come. That clear? So just for making you to understand the practical class, I have taken the question and I have discussed here. Don't be thinking the same thing, and don't come and tell me, ma'am, this kind of question did not come. And I did not take the question paper. Ms. Vani will be taking the question paper. Is that clear? So this is a old question paper, just for you to understand. So now, so can we have the discussion? So group, did we complete group 1? We have already completed, right? So we have to start with group 2. So group 2, yeah, I'm not able to hear anything.
Can you hear me?
Yes.
For our group, we have to strengthen the internal rotator and external rotator muscle.
Okay.
So this strengthening program can do in buoyancy supported, buoyancy assisted, and buoyancy resisted position.
Okay.
So for the internal rotator strengthening program, for the buoyancy assisted position, the patient will be in side lying on the affected side, and they will do the movement with their arm at the side and elbow 90-degree flexion. So they will do the internal rotation movement with the buoyancy assisted.
Okay.
And for the buoyancy resisted position, the patient will be in prone lying with their shoulder in 90-degree abduction, elbow 90-degree flexion, and they will do the internal rotation movement, which is they will bring their arm together. So this movement will be resisted by the upward force of the buoyancy. So for the external rotator strengthening, the patient will be in prone lying for the buoyancy assisted position. The patient arm will in front and with their elbow 90-degree flexion. Then they will do external rotation by bring their arm apart or towards the ceiling. So this position will assist the patient movement. For the buoyancy resisted, the patient will be in side lying on the affected side, and they will do the movement with their arm at the side and elbow 90-degree flexion, and they will do the external rotation. So for the buoyancy supported position, for both internal rotation and external rotation, will be in side lying with their shoulder abducted 90-degree and elbow flexion 90-degree. So in this position, the buoyancy will not have any effect on the patient movement.
Shoulder, for the last one, can you repeat? Inside line.
The buoyancy supported
Yes.
position, the patient will be in side lying with shoulder 90-degree abduction and elbow 90-degree flexion, and they will do the internal and external rotation. So the buoyancy force will not act against the patient movement, will not have any effect.
Okay. Same thing like you can also do in standing. So in standing with the shoulder in neutral position, elbow 90-degree flexed, you can do the internal rotation and external rotation. That also will be counterbalancing your buoyancy. Okay. Okay, so here you can just correlate our MMT, manual muscle resistance, and hydrotherapy. So whatever, like when you are testing the muscle, the positions that you have used for against gravity. Okay, so the positions which you have used for against gravity, that means muscle power 3 and above, that will be for your buoyancy assisted. Is that clear? So it is just opposite. So the positions whichever you have used for uh, resistance will be just for assisting buoyancy. Is that clear? So you can just correlate like that also, and you can remember. You don't need to mug up the things and keep remembering. Is that clear? Just a correlation, or you can just sit in the exam room, think as if you are inside water and do the movement and you can write it. So don't need to mug up and write all these things. Okay, so next person, next group.
Miss, able to hear?
Yeah.
Okay. So for my group, we are going to plan for the bicep and tricep, which are the elbow extensor and flexor. So for the counterbalancing buoyancy, both bicep and tricep can be carried out in the side lying position. Then meanwhile, for the biceps buoyancy assisted position, it can be carried out in the standing position. So standing position also, it can be carried out for the tricep buoyancy resistant position. For tricep is also standing. So meanwhile, for the biceps, buoyancy resistant position is in prone lying. For the tricep, prone lying is the buoyancy assisted position. can you
Okay, wait. Let me just imagine.
okay.
Okay. Okay, I think correct.
Okay, yeah, Miss, I want to ask a question.
Yes.
When we carry out the strengthening, right, with using hydro, when we strengthening, is it that we are scratching the muscle also, the antagonist also?
Yes, we will be stretching the opposite muscle.
Oh, okay. So that means 2 in 1.
Yes.
Okay, thank you.
Even in land activities also same thing. We will be stretching the opposite muscle.
Okay. No, thank you.
Okay. So next group ready?
Yeah,
How many
miss.
groups over? 3 groups over.
Yeah. Now it's a 4th group, miss. So miss, my group is a hip extensor,
Okay.
and then it's using hamstring muscles. So hamstring muscles, which is used for hip extensor. Firstly, for there's 3 types: gravity eliminated, buoyancy eliminated, buoyancy assisted, and so buoyancy resistant. So to help for strengthening for buoyancy eliminated, we can use side lying on the affected side, and then for buoyancy assisted, you can use on standing,
Okay.
and then buoyancy resisted, you can use on prone lying.
Okay.
Correct, right, miss?
Yes. For extension.
This is for strengthening for flexion. Then for extension, for buoyancy eliminated to strengthen extensor, it can be side lying also, right, miss? And then buoyancy buoyancy assisted can be on prone lying, and then buoyancy resisted can be on supine lying.
Buoyancy. Okay. Supine lying. Okay.
Okay, is correct, right?
Yes. Correct.
Oh, okay. So miss, I wanna ask so for
Yes.
stretching, right? For stretching, for example, for hamstring muscle, which is used for hip extensing lah. Then when you want to stretch hamstring, right, you do the opposing, which is flexing of the hip lah.
Flexing of the hip and
Yeah.
extending of the knee.
And extending of the knee. Yeah, okay, understand. So doesn't need to be on for stretching, and doesn't need to be on buoyancy eliminator or any buoyancy, can be on
Okay.
any position, right?
If you are using buoyancy assisted, then the buoyancy will be helping you to give you more stretch.
So buoyancy assisted is the most best for stretching.
Yes. For example, yes. If you are for hamstring, if you make the person to stand and do the hip flexion, then buoyancy will be pushing the hip to more flexion. So that will give you good stretch for hamstring.
Okay, so for hamstring, which is for extending the hip, so to stretch, so I'll use in so I'll go for assisted, so I'll go for prone lying. Is it?
For hamstring, you need to do in standing. In
Okay,
standing
okay.
only, the hip flexion will be assisted. You need to think of hip flexion, the
Oh,
opposite muscle group.
Okay. Understand. Okay, thank you, Miss.
Hello, Miss.
Okay, yeah.
I have questions about the hip extensor. For the buoyancy assisting, just now we discussed that the answer is in prone lying. Is that means
Buoyancy
that we?
assisting, right?
Yeah. Buoyancy assisted in prone lying. So it means that we are doing
Actually, no. Actually, buoyancy assisted, prone lying also you can do, but it will be coming out little bit surface. It will be coming out of the surface. From flexion, if you are doing, you can also do in standing.
So
You can just stand, and you can also do in standing also. Standing. From neutral, if you bring back, that is your extension. So you can do in prone as well as you can also do in standing.
okay, thank you, Miss.
Sorry, I missed. Then if the leg is outside of the water, then
Then
like,
it will
does
be
it?
more resistance. Like if the person is having lesser muscle power, then it will be little difficult.
Oh, okay. I see. I understand. So you can say that standing is actually more easier than
More easier
prone lying
than
lah.
prone lying, yes.
Okay. I understand. Thank you, Miss.
Okay, just give me 2 minutes break. Okay, I'll just come back. Okay, sorry. Can we go for the next?
Hi, Miss.
Yes.
So I'm going to say about the quadriceps, which is knee extensor.
Okay.
To strengthening the quadricep, have three type, which is buoyancy assisted, resisted, and counterbalance. So the patient will in standing position, hip flex, and then knee flex, then extend. This one is for buoyancy assisted position. And then the patient will be standing.
Wait. In standing,
Hip flex.
Okay.
And then the knee is flexed. And then the patient will have to do extension of knee.
Okay. So here, instead of standing, you can make the person to sit in the noodle, like a chair.
Okay, Miss.
So that will be more helpful for the patient. So they can sit over the noodle and they can do knee extension. So that will be buoyancy assisted.
And for buoyancy resisted, the patient will be standing, hip extended, and then the knee is flexed, and then the patient will have to extend the knee.
Okay, yes. So the patient has to keep the leg little bit in extension and flex the knee and do the extension. Okay, then so you can also do this by doing a squatting. So make the person stand in water, maybe at the waist level, and try to do squatting. So here the body weight will be giving them the resistance.
Okay,
Okay.
Miss. And then for buoyancy counterbalance position, the patient will have to side lying
Oh,
and
okay.
then doing knee extension.
Yes, okay.
Then for stretching the quadricep, we go for hip extension. So the patient will have to standing
For
with
stretching, you need to do
hip extension.
okay.
The patient have to standing and then tied with floaters at the leg to provide upward movement for further stretching of quadricep.
Okay, so manual stretching, we will be making the person to be in prone lying and we will be doing the knee flexion, right?
Yeah.
So same thing in water means same thing in water means the patient can do squatting, that will be giving you stretching, isn't it? just a moment. Okay, so instead of so much confusion, you can make the person to do squatting, and that will be giving them more stretch for quadriceps. Okay.
Okay, Miss.
So this is the last group, right? Do we have one more group, or this is the last group?
Hello, Miss. Our good left. Hello.
Oh,
Hello.
yeah. Okay.
Hello.
Okay. Yeah, I can hear you.
Okay. So, for our last scenario is about the anaerobic exercise. So
Yes.
also is known as the cardiovascular exercise. So for this case scenario, we'll give a patient the deep water walking or jogging. So the patient must with the buoyancy belt for the safety purposes. And then we, as a physiotherapist, had to stand aside to guide the patient do all kinds of things. And then patient have to be suspended vertically in the deep water, and the whole body is immersed to the neck level. And then while doing it, make sure that keeping the torso is upright without laying too far forward or to either side. And then walk with a long stride. And then press into your heel first before rolling your weight onto the toes. And then make sure that we have to swing our arms when we walk. So alternatively, we can do like a high knee marching and also the cross country movements. And then progressively, we can like give a patient like tag a additional floater at the patient wrist region or the ankle region to give more the resistance. And then one more thing, I don't know, Miss can just one more opinion from me lah. For the progressive, we can like give a patient like a water turbines to generate waves and bubbles like a resistance toward the direction towards the patient, and then thus we call the patient to keep on doing the walking and the jogging
Okay.
movement.
So for so same thing like for resistance, you can also make them to do jogging and walking without touching the floor. That means the patient has
Yes.
to be in a higher level of water with the maybe till the waist level or till the Ziffy level, and without touching the water, they have to go for walking and jogging. So that will be giving the maximum resistance for them for aerobics.
Okay.
Okay.
So Miss, like without the foot touching the bottom of the pool, if we give like a patient like a wave, the turbines are kind of waters are resistant to the patient, where the patient will be like able to control themselves or something.
No, without the this one, like without increasing the speed of water, you can also make them to do jogging and walking without touching the floor. So that will be giving them more aerobic, that is cardiovascular stress.
Yes. Okay,
And
thank you,
like you
Miss.
have also seen that water bike and other things, right? Treadmill, water bike, lot of things have come now. But only thing is like maybe Western countries they use it. For Asian countries, we are not able to use those kind because maintaining the water quality is very difficult. That's why many hydrotherapies are not working, because you need with our temperature, our rainy, like sometimes it will be raining, sometimes it will be hot, right? So our pollution, temperature, all those things makes water quality very dirty. So maintaining the water quality is very tough. So that's why in Asian countries we are not going more towards hydrotherapy. But whereas in Western countries, you can see almost all the hospitals will have this hydrotherapy. Okay, so I hope you would have got a good idea about all about the hydrotherapy. So maybe if you have any other doubts, then we can discuss. Like you can just note down all your doubts, and we can discuss on Friday. So tomorrow we will go to a different topic. Okay. So coordination. Is that clear? So exam point of view, if you want to discuss anything, then maybe we can discuss on Friday. 1 hour class. Friday, maybe, or tomorrow also we can discuss, no problem. You can just note down all your doubts and other thing. Okay, so the next
Okay.
class, they have behavioral sciences. So I'll just close the session. Okay, thank you.